Aloha, my name is Victoria Franco, and I am a student in the BSW program at Hawaii Pacific University. And today I'm going to be talking about Kupuna in Hawaii and the need for adequate support. So a quick introduction is here in Hawaii, Kupuna is defined as an honored elderly, and those 65 years of age and older are considered kupuna. And according to 2019 statistics from the US Census Bureau, since April 2010, kupuna in Hawaii have grown by 37.6% with a 3.5% annual average growth rate. So in comparison, the overall population of Hawaii has only grown 4.1%, which is a 0.4% annual average growth rate. So as you can see, kupuna, there are more and more kupuna here in Hawaii, and therefore there is a need for more resources. So through my experience working at our kupuna for my practicum, which is a nonprofit organization, and their aim is to provide food security for kupuna. So through working there, it's been identified that many kupuna do not have social workers or case managers who can advocate for their needs and connect them to resources. So our kupuna started in the middle of the pandemic when there were many volunteers who were able to give their time because they were off of work or their kids are home. So they had extra time to support kupuna by going grocery shopping for them and helping them get their essential items to include pharmacy medications. But since things have gone back to normal, there have been a shortage of volunteers because many of those volunteers had to go back to work, so they no longer have the time to support kupuna. So because of that, we turned into a referral-based agency. So honestly, if it were not for that, this whole project would not have even come to fruition because it wouldn't have been a thought in my mind. But since we do need referrals from kupuna, it's really been eye-opening to see the need for it all and the need for case managers and social workers. So at our kupuna, they need a referral letter from either a case manager, a social worker, or a healthcare professional. So the point of this is to discover where the gap is with kupuna receiving adequate support, discover how kupuna feel regarding their age-related needs, and discover whether kupuna do have a case manager or social worker assigned to them to help with their age-related needs. So many of my methods come from experiential means. So with conversations with the social workers and case managers while conducting case management for the kupuna, and speaking with the kupuna themselves. And I also attended a workshop with the Medicare benefits consultant and attended a kupuna roundtable that was conducted in February. And I did literature reviews on insurance, age-related needs for kupuna, as well as like Medicare and Medicaid. And then I analyzed the data of the kupuna profiles that we have in our kupuna program. So I decided to analyze the data of the 117 kupuna that are currently receiving services from our kupuna, and 30 kupuna have Medicaid. And this is important to know because there are many challenges with Medicaid and Medicare, and Medicaid is for low-income people or people with disabilities. So knowing whether or not the kupuna have Medicaid, it better helps us understand their financial state, as well as other resources that they may qualify for. So in regards to the referral letters that we have on file, 30 kupuna have them from social workers, 26 from case managers, and 42 from healthcare professionals. So just looking at the numbers, we see that 98 of the 117 kupuna do indeed have referrals. And, it's great because 56 of them do have a social worker or case manager, which is what I'm stressing, right? However, with detailed analysis and reading the actual referral letters, it's very evident that many of them are not like their permanent social worker or case manager. So many of these kupuna have received referrals coming right out of the hospital. So it's just a general hospital case manager who will only, do a referral based on what they know from possibly that hospitalization. Some of them also receive these referral letters from agencies such as like BIATA, where they're receiving like occupational therapy or physical therapy. So again, it's very like short term that we're receiving these referrals. So therefore, these case managers and social workers don't actually know the full picture of the Kupuna. And some of the referrals come from healthcare professionals, which again, there's a gap because a healthcare professional doesn't always know themselves, the full picture of, the Kupuna's home life and, what's going on inside the home, as well as, the finances, and to see what they're eligible for. And then also what was notable is that with any interaction that we do have with the Kupuna, we do put in activity, and there are many, keywords and phrases that were common through a lot of these profiles, which confusing, overwhelming, hard. They can't afford things, the wait list, there are no caregivers. They don't know how, and they're in pain, or, it's hard to understand. So just all these challenges really come about when, talking about whether or not, they are able to advocate for their own needs. So pretty much in conclusion, Kupuna face challenges advocating for themselves due to their, visual hearing impairments, mobility issues, the lack of knowledge, lack of resources, and Kupuna need adequate support. So they need help with Medicare and Medicaid applications, from attending that workshop. It's known that they are difficult. The process can be difficult and can be very overwhelming if you don't understand all of the jargon. And just there is a need for assigned social workers and case managers, so that way our Kupuna are getting the support that they need, and we can help streamline the process for them, and just connect them to resources that they definitely need. So here are some of my references. And thank you for viewing, and I look forward to answering any questions during the 2022 Capstone Symposium. Mahalo.